Welcome to Womb Talk. I'm your host, Elizabeth Vanderwell, the owner and founder of Fruitful Womb Doula Services. In Womb Talk, we like to go over different topics that are acceptable for all audiences. We're not medical professionals, and everything on this podcast is to educate you so that you can make better choices for your body. If you have a passion for all things women's health, then let's start listening. Today, I'm joined by the lovely Rachael Van Schoick. Nope, I still pronounced it wrong. Correct me and just tell us a bit about yourself, please.
That's okay. It's okay. My name is Rachael Van Schoick, and I am a licensed massage therapist and a prenatal and postpartum specialist, focusing on all things birth, prenatally, postpartum. Oh, and I'm also a birth doula. I always forget that part because it's relatively new to my full circle.
Congratulations. We love more birth doulas in our circle.
Thank you.
You had mentioned also that you were a soma therapist and trainer, corrective exercise specialist.
Yes.
A little bit about that.
So, a soma trainer and a soma therapist are under this different umbrella where I have learned from a French osteopath named Guy Voyer. And he taught me a million different ways to look at the body in a whole different sense, where osteos in Europe and in Canada are very different from osteos in America, where they focus more on manual therapy to heal the body versus giving out a prescription, let's say. And these manual techniques from the soma therapy standpoint are in link with working the fascial system, working through organs, working through our diaphragms, working through joints and ligaments versus the like muscular tissue itself. So I have done that program, which is a full abundance of knowledge you can obtain. And in conjunction with that he had an osteopath program. So I had started that as well. And then the soma training is more specific onto what we call segmental exercises, where they're focusing on specific muscle fiber directions and the actual muscles that are in conjunction with them. And then these other specialized exercises called ELDOAs, which are spine-specific exercises that help open the space between your discs, essentially. So your own kind of decompression mechanism for each level of the spine. So I combine the manual therapy with the exercise and the specialized ELDOAs to really help bring everything full circle to help each woman heal from inside out, essentially, to really like take their body to the next level and enhance it in the way that we should be able to.
Oh, wow. Well, you kind of answered my second question. I was going to ask you about what
great.
ELDOAs.
Perfect.
I've never really heard of this approach that often. Is this more of a newer technique, or it's been around for ages and kind of different parts of the world? Like, if you'd love to share a little bit.
Yeah. So, I mean, it's been around for a little bit, but it's not very like mainstream, and it's so very different that's probably the thing I get told the most is when people either see me in person or if they take a class, they're like, what did I just do? Like, I have never done anything like that before in my entire life. And it's so true because it's so different and it makes you learn about your body in so different ways that we don't get like from a class standpoint, right? We go through all these movements and here's this exercise, do this many sets, reps, yada, yada, yada. But they're not very positional based of like, okay, let's make sure this is in this position here. This is position here. This goes here. This goes here. I always tell people that the name of the game is trying to do 6 things at once. And that's specifically for those ELDOA exercises. But they're really not mainstream, but they're really extra in sports currently. So there are a lot of MLB and NHL and NFL players trying to get themselves to, again, perform at their highest level. And these sports teams are definitely where you want to be at this highest level, but we can train just like sports teams. So, I really want to help implement it into other people's worlds. And especially when it comes to pain, these things are like dynamite to help with all things pain related because of how the body connects to each joint each segment of the spine, and so on and so forth.
Oh wow, that definitely sounds very interesting. I have never heard of this before at all. This is class with Lisa. Like I'm getting to learn things too.
No, it's great.
And you had mentioned a manual therapy approach in our
Mm-hmm.
emails back and forth a little bit. Did you want to talk to everyone about that and how they're different a little bit?
Yeah. So I'm different from a massage therapist in a stance where it's not of the like nice lit stance. Here's your sheets, get undressed. Here's the lotion. Here's this, here's that. Although there is such a place for it and it's so wonderful, I am more of a medical approach in a way where I'm dealing with more joints, ligaments, and fascial systems that connect with one another and how the body moves in segment with that. So the other way you can kind of, I guess, compare it to is similarly to like cranial sacral work in a way.
Okay.
So there's ways that can help reduce swelling, and there's ways that help create a general rhythm of our fascial system and our cerebral spinal fluid, and how those general movements help our body move in different ways and then help our body essentially heal itself. So it's enhancing those systems that we have to make everything heal faster, essentially, and work better, quicker.
Oh wow, this is a very in-depth kind of process a little bit.
Yeah.
It sounds a little hard, like on the person to do itself, because if I'm not getting a massage, just kidding.
Yeah, it's it's different because it's very interactive in a different sense. So it's not some of the more, you could call it like cranial sacral work, we call it fascial normalization. That's more of like where you could say like more relaxed in a sense, where you're not doing much. But the other stuff, when it comes to what we call joint pumping, and that really helps move the body and have you very interactive. So you're pushing places and then you're relaxing places. You're moving something and you're not moving something, opening up a joint space to then relax a joint space. So everything's kind of, you're moving around, you're switching sides, you're doing a whole bunch of things that you wouldn't typically see in a normal, let's say, massage session, I should say.
Okay. And you were mentioning you were a birth doula, and I was
Mhm.
just a little curious if how you're coordinating the two together. Like, is it going to play a big role in that side? I'm just now curious a little bit. I'm putting you on the
Yeah,
spot.
yeah. So I am trying to combine it more in a sense of helping the pelvis be able to be in more alignment, and then have the ability to open and close where we need it to in the positions that we need to. So trying to bring it better than just a prenatal massage, which again, wonderful, we love them, but sometimes we really need something to like really change and really manipulate tissue, not where in a sense where it's painful, but in a sense where things are moving so that we can get things realigned and get the, pelvic, the sacrum to counter nutate and nutate so that baby can kind of get into the pelvis better. So we can help aid that process with manual therapy on top of all the birth prep stuff, all everybody knows. And so it just gives it that extra touch. So that way, if I'm in a delivery room, I can say, hey, you know what? You're here. I'm going to do this kind of technique to help release this, to help baby to fall down a little better, or to get them in the right place, to then really kind of bring a different touch and a different feel to being a doula than the average one, let's say.
Yeah, like me. I was just gonna say,
But they're still good. I mean, they're all good, right? Like it's all the it's just giving just an extra touch is really all it is, because just doulas in general are just amazing, and that's why I became one, because I didn't have one, and that's a different story if we ever want to get into
no,
that.
it sounds like a really amazing thing that you yourself have the knowledge on how to help women in this like different aspect that you can connect with your birth doula work. And I think that's really
Yeah,
incredible. There's nothing wrong with
thank
that
you.
entirely. So I think it's going to be very beneficial for whoever hires you, because like I said, you know the insider secrets.
Thank you. I'm trying.
So, do you have a belief surrounding certain exercises or things that women should be doing more of during pregnancy, leading up to postpartum, maybe things they do on their own or that you kind of teach them a little bit along the way of working with you?
Yeah, I mean, I think probably, I mean, there's so many, but I'm going to go with my top two.
Okay, sounds good.
Okay, I'll do top three. Top three. My top three would be your posture, your breathing, and your core connection. And or connection in general to the body. And that's going to be core and pelvic floor. So being able to try those three things in to any part of your pregnancy will not only help you with the pregnancy, it'll help you with the birth, and it'll extremely help you in postpartum if you know those things in pregnancy to go into it.
Okay, wow. Yeah, if you've watched the podcast or you heard it before, I always say, I've been doing this for 5 years. I'm like, I still don't know everything. Obviously, I'm learning something new today.
That's okay.
And with like new mothers and stuff like that, the window of 9 months is so short on like what things to be focusing on. And like, there's your approach with like manual therapy, ELDOAs. Am I pronouncing that correctly?
ELDOAs, yes.
ELDOAs. See, I'm obviously doing everything in the pronunciation.
That's okay.
But then, you have certain exercises that need to be done. You have, prenatal learning, like how birth works, all that. Like the amount to do is so much. That's why I always tell people, I'm like, even if you're not trying to get and have kids like now, maybe like start studying just a little bit. Like, so you're not just jumping in and being like, hey, 9 months, let's try to learn everything and get a migraine.
Yeah. And I say that especially to women in between pregnancies.
Yeah.
Because a lot of people, once they have, let's say they have their first and they didn't do anything, or maybe they did too much, whatever the case may be. But then they're like, oh, well, I'm not going to do anything in between my pregnancies because, well, I'm just going to get pregnant again. And that's actually like the most optimal time for you to do things. So that way things aren't so hard during pregnancy. And then your postpartum recovery can be so much easier during that time too. Like it's a great opportunity that we have there versus taking the other narrative like, oh, well, it's just going to happen again, so I might as well just let it do its thing, where we can just really help guide the body into a better situation, both mentally and physically, to carry differently and reduce pain and better birth outcomes and all those good things that go along with it.
Yeah, and like I said, I've never heard of this before. So the fact that it's kind of like a hidden trade secret, we need to get it out there more.
Right.
Start sharing with all of your mom friends or mom-to-be friends. Because
yeah.
But I guess in the sense you were mentioning about posture and things like that, is that something that you suggest that they do by themselves, or like they need you for that help? Like, how can they specifically work with you to get that kind of technique learned or something like that?
So there are several different ELDOA practitioners, are what we're called, in the world. So they are people around the world and around their certain area where you are. But I do offer that service in person and online. So it can be taught online just as much as it can be taught in person. Oh. Just like anything, we always can love a personal touch if someone's there to give a critique here and there, but it can work the exact same through online, which is what I do too.
Well, that's awesome because it's definitely needed. And if it's online now, everybody, I'm like, worldwide, go get her. Book you
right, yeah.
It's needed. Like, I'm surprised on like how it isn't talked about that much. Like, especially since it seems so needed. Like,
yeah,
you hear about a massage therapist. Like, I even tell my clients, I'm like, oh, you should get a massage therapist or a chiropractor.
Right.
Like, it's standard. But this is something kind of new. Well, you didn't say it was new, so I mean, it just needs to be spoken.
It's just so different. It's just not what we practice here in the States. It's more proactive versus reactive, and it's a very hard mindset shift to make. And they used to actually teach osteos here manual therapy, a lot of it, and then it changed once the pharmaceutical companies got word that it was doing well.
Of course.
And so they changed that quickly and said, no, we're going to take that out. And long story short, they took it out, they put pharmaceuticals in, and now we don't have any more manual therapy osteos in the States other than the very select few that are still around.
Oh, wow. It's such a shame that kind of stuff happens always. Roll my eyes.
Yeah, I know. Same. Trust me, every time I went to a course, that was the only time I ever got treated, because I only wanted my teacher to treat me, because I was like, well, like 20 million other things that other people don't. So like, you're just going to treat me. And if I only get treated once or twice a year, so be it. But it's just very different.
And what kind of made you come to this work? Like, what led you to start this, and like what is your reason for it, your belief behind it?
So, truth be told, I went to try to go for physical therapy school, and I just wasn't, I'm not book smart. Or test smart. I'm not test smart. I can read the books, I can know the things to do, and I can figure out the treatments, and I can do all the things. I worked in several different PT places for several years for all the amount of hours I had to do, whether it's rehab in the hospital or rehab at outpatient, inpatient, like I've done it all, and like years worth of it. And after I didn't get in, after the third, fourth time, I said, you know what? I'm going to go be a massage therapist, and then I'm going to take exercise. And then I happened to find this one person who was doing this manual therapy stuff. I was like, oh, what is he doing? I was like, I need to know that. And then I sought him out, figured out where he worked, got a job there, and figured out what the material was he's learning, and then went down the rabbit hole. So like, it was more of like a piece together, find the things that I wanted to do, found that one thing, and then went down the hole of like, okay, I'm going to go through all of these certifications, all of these things that no one's doing, which is typically the area I like to end up to, because that's just how it works with me. I end up going with that outside of the box, and like, I've never heard of this. I'm like, great, perfect. I'm going to try to explain to you the best way I can, but we'll see how that goes.
Well, see, everyone, that's the best thing. You got to be very observant, see what other people are doing, and then go kind of stalk them on the internet.
pretty much. When you see, honestly, it's like when you see what you want, you have to go for it, and you just try. What's the worst that can happen? They say no, and that can follow you through your pregnancy, through your birth, through your postpartum experience, like any of those experiences, whatever your outcome is of your goal. If you can just keep that goal in mind and like know what you want, and not let anything else get in the way, or even if things do get in the way, just you keep overcoming the obstacles. Same thing as with business, right? Like we keep trying all these things, and sometimes a lot of things don't work, but you can't stop. You just have to keep going and going and going. And one thing, sometimes it'll just go. And you're like, great, yay.
Well, I fully applaud you, because you went after your goal, and now you're here today. You're teaching people about it. Like me, I didn't know anything, and now I'm going to be like, well, now I got to find something, because I need to know more about this.
Well, that's great.
Yeah, because that's the point of these things, right? To teach people. Like that's what I try to encourage so much of Womb Talk, is that as women, we don't know that much about our bodies and like the things that are needed for us. And you were mentioning in the beginning there too that you wanted to bring this into birth. Is this common to have are there other people out there that are also trying to put this into birth work? Because you had mentioned that this was a separate entity as well. People could go it if it's not during birth or postpartum.
Yeah, I don't know yet. I know there was a couple other women that were trying to bring it into like women's health.
Yeah.
But I don't know of anyone yet specifically going into this area that I am, which is kind of nice, but kind of like, oh no, at the same time, right? Like,
yeah, but will come to you now if you do it online. So
yeah, so that's what I've been trying to do, is trying to build this online, which is why I have my my Power and Postpartum program, which is all online. It's an 8-week program that combines all of these exercises with the stretching and the ELDOAs, and really just tailoring it, getting you back to returning to fitness, because I feel like lots of us are so lost after postpartum of like, now what do I do? Like, how do I go back to what I was doing pre-pregnancy? Because I feel like I can't do anything. And it becomes very disheartening very fast. And I want to build a community to let everyone know, like, it doesn't have to be that way. There are steps to go in the right way to do this. You don't have to feel alone. You aren't lost. You will get your we'll call it your postpartum body back, but it's just going to be a different, better one, because you're going to have so much more knowledge about yourself and information that it'll just be 10 times better than you even had it before, which is even different and better.
Well, I think that's very true in case, because I've heard a lot of people say too that birth is kind of like a life-changing experience, obviously, for women. And there's a lot of stuff that, like, my past clients have said too, where it's like I feel like a different person afterwards. And so we're in this very sense in the modern day where we're like, oh, we got to go back to what we were, but there is no going back. You can't. It's a whole different thing. And that's where learning these kind of things during that, in likelihood, probably even before then, would even be better, right?
I mean, that would be also fantastic.
But sometimes.
But yeah, it's exactly. And you know what? It's just there's so much stuff out there that you don't know what's the right or wrong thing. And what might be right for you might not be right for the next person. And that's what I like to dive into, even though it's, a program that can all be tailored, can all be shifted, because one person's not going to be able to do one thing and another person's not going to do another thing. And that's okay. And that's why I make it like live group sessions, so that we go together through it and pick out what we need to do and vary it and, change all the things that are specific. So,
because there isn't a cookie cutter approach. There isn't.
There isn't. There isn't. There can't. Absolutely.
It's crazy. But in all honesty, do you have any books? I know you were mentioning your class kind of program training thing. Like, what other classes or things should people try to look for online? Like, is there any books out there about this, or just something that could get people like a starting point even?
Oh, man, that's a tough question. I didn't prep myself for this question.
No.
There is no books on this stuff.
Really? You're going to write one,
I guess. That's not a bad idea. But no, there isn't any books on this stuff, because it was a lot of stuff placed together from this one osteo. And unfortunately, we, rest his soul, we just lost him in June unexpectedly.
Oh, wow.
Which was like a huge shock to all of us who studied under him. But there's only other higher education of anatomy and fascia books that I can really refer to in my brain, which I don't think probably a lot of listeners would want to read those.
Well, there you go. You're
maybe. You never know.
After this is like, I gave her an idea on the podcast. You'll be back to tell us all about it.
Yeah.
And then you mentioned
it's
a program, right? A class that they could take to learn more. Would you like to tell us a bit about that?
Yeah. So that is the Power and Postpartum program, and it is just the A to Z of how to return to fitness, reconnecting with your body. And it doesn't matter if you've had a vaginal delivery, a C-section delivery. We go through massage techniques. We go through reestablishing that connection to our body, our posture, these ELDOA exercises, and really just a foundation to build on to then get you to the next level, whatever that level you want it to be, even if it's just to have another baby. Just building that foundation alone will help you so much between diastasis, back pain, leaking, pelvic floor problems, all of the things that come along with body changes, because our body changes so much during pregnancy. Right. So it makes such a huge difference when we can almost fight against gravity to reestablish those connections and find ourselves in a better place, because we're holding a little one for so long. We're looking down at them. We're feeding them. We're, contorting ourselves, sleeping in a bed, trying to get them to sleep because they're not sleeping. All the things that happen with that is this program goes through everything, which is huge.
That sounds really awesome. Everyone, you need to go get that. Where can we find you online? Like a website, socials? If you're in person, where are they going to find, like, how are we going to hunt you down? We got to stalk you ourselves.
How are we going to hunt me down? Yeah. So you can find me on Instagram at alignmovement_therapy.
Okay.
My website is just alignmovement.com. I am located in New Jersey, and I serve Ocean and Monmouth County, where I do a concierge service. So I go to you. I essentially bring my table and anything that I need to go through all the stuff that we need to do. And then I also do online work, which is these programs and online one-to-ones too, wherever I have the time to fit it in.
Well, then everyone's going to have to like now find you like you did that guy that you would chase.
Yes, exactly. Please.
And then is there anything that you want to end us off with, like a tip that you would give to women, regardless of age, or a positive quote, something that stands out that has made you kind of get through to where you are today that you would want to pass on to others?
Yeah.
This one always I would think.
Yeah, it does. I'm going to say two things.
Okay.
I'm going to say prep yourself for all these occasions. Like make sure you're doing the prep work of what pregnancy is like, what you should be doing, like how your body's changing, what that means, what's a birth experience look like, or what you want yours to look like. Those are definitely things that I didn't always do for my first two pregnancies. Not saying that I'm pregnant now. That's if I'm talking like I am, but but what I mean is don't be afraid to educate yourself. A lot of information is scary, but the more knowledge you have, it actually gives you more power in the end to accomplish whatever the goal is. And it doesn't matter what that goal is, as long as you're okay with that goal. And then the second piece to that is don't put your mental health second. Put that right first as well, because that was a barrier for me in moving forward in my even like fitness journey, you can call it, or getting myself back to whatever I am now, right? It was a barrier that stopped me connecting in different ways than I needed to connect, because I didn't process certain emotions from the events that I had from my births. And I think that's extremely important to tie into during pregnancy and tie into in postpartum and all the things. And the more we can mentally prepare ourselves, the better we can just either be okay with our situation, or find ways to manage that situation where it doesn't feel like, oh my gosh, or so overwhelming.
Yeah.
So those are
that was a very deep emotional tidbit that we've got for everyone. They're probably like, we got people thinking now, really thinking.
Yeah.
Oh. And so is there anything else that you want to close us off with? Any last thoughts that you want to mention about therapy or anything like that?
Just know that how's the best way to explain this? Not all therapies are the same, right? Yeah. And I guess one thing I'll even just mention to, like, from the therapy that I do, from a standpoint, if you're thinking like, ooh, well, you sound like a chiropractor, or you sound like a pelvic floor PT, like, what's the difference of all those things? Would just be that I don't adjust and I don't do internal work. So I'm very full body, different approach, and just stuff you're never going to see before, which is like triggering. It's like, what do we mean?
Totally mysterious.
And I'm gonna keep you on the what do you mean seat, and then maybe you'll come and find out. And if anyone ever has any questions, I am always more than happy to answer anything, all things, any of the time. I am an open book, so anyone can reach out at whatever they want.
They have to stalk you now. Now we've put the ball in their court. You did the work in the past. Now we're giving them the work to go do that.
Exactly. And I've given you all the things now.
You've started us off, and now we're going to have to, just like you, dive right in, be curious. So, well, thank you so much for coming.
Yes, be curious.
I really appreciate it.
Oh my gosh, thank you so much for having me. I truly appreciate you having me here. It was such an honor to be on your show.
Yeah, well, when you write that book, you're going to have to come back, and then we're going to have to talk about the book. Now you know that you're the only one who has to do it, apparently.
Yes, and you've given me a very good idea now. Thank you.
I've planted a seed. Go forth.
You did. You did.
Well, thank you so much again. And everyone, you got to go find Rachael and you got to look her up and find out about this therapy thing. I may even have to hunt her down because now I still have questions. Thank you
Yes.
so much. And make sure, everyone, you tune back in next time for another episode.